Hi guys, this is Dr. Chaffin. I am actually senior instructor for Simply Implant Institute here in Phoenix. I wanted to, I've gotten a lot of requests of saying, hey, what separates the Institute in Phoenix versus other courses? Honestly, a lot of these courses we're going to talk about tonight, real quickly, are great courses. A lot of good educational programs out there. I believe that, when you're learning a skill, skills are come by getting educated on the skill, training on the skill, so you can implement the skill. We call it here at the SI Institute ETI. So you want to have educated, which you want to learn lectures, you want to read books, you want to get as much information in your mind. That's just good, that's healthy, that's awesome. And then when you take that information, you want to be able to apply it in training. And you want to do it on a live situation in surgeries, or if you're learning how to prep a crown, you want to do as many crowns as you possibly can do. Remember back in dental school. And then when you leave dental school and you're back in practice, for the first time, as you remember when you're graduating, you're doing your first crown when you work for somebody else, when you just got out of school on Sunday and you're doing your first crown on Wednesday, you have some sort of confidence in what you're doing. So the same applies for implants, surgeries, and how to learn implants. So implants is a great skill to learn. I think it's something that every dentist should pick up. The next 10 years of implant, of just dentistry in general, I think general dentists are going to be behind the times if they don't learn this skill. So, to kind of talk about things, I broke things down. We broke things down from a pathway called the SI pathway here to the left, and then I also, to the right on the chalkboard, are other ways to learn with other programs that are available on the market. And let's first talk about time. That's probably an important factor, and that's an important factor to me. The reason why it's an important factor to me is when I learn a skill, I do not have 2 years to learn it. And I quite frankly don't think that implants take you 2 years to learn. Okay, maybe 2 years to be really able to do some of the advanced stuff, but let's talk about the time. A lot of companies have really good programs, but things work differently in these programs. So let's remember what I told you on the first point in my intro about education. So they first break, a lot of programs on this pathway break their program into educational and then training. So in some programs you have like 4 courses, you have to fly to 4 different cities, and they're 4-day courses each. Well, that's a lot of courses for didactic. They're probably amazing. Once you're done with those, then you can fly to a location and you can do your training. So heard good stuff about that particular program. You got other ones that are like a 2-year training course, and then you can actually get done with that and then maybe be eligible to do their didactic program. Then you have some other courses that they do their educational program in like 3 or 4 days, where you get the educational right there, you get to observe a couple surgeries, and then you get to go home. So that's all education. Now, from there, a lot of those programs will say, hey, now you're ready for our didactic, so why don't we go to Guatemala and you're going to place X amount of implants there. Awesome. But that's also another trip out there, so that's another time that you're going to have to take away from the office. Then you have other ones that are saying, hey, listen, why don't you come in, bring your own patient, and we'll let you do a couple surgeries, maybe 1 or 2, okay? And then there's a few places where after you go through a whole 4 set of programs, you can fly into one and do 10 to 20 implants. There are a few courses out there, and I'm sure they're all great, but it's a lot of time. The SI pathway, 4 days, and we will combine the educational component with the training component. And that's the difference between the two systems. A lot of people believe you need to educate and then train another time. We believe that education and training needs to happen at one shot. We find that our students get consistent results doing it that way. It's pretty intense, but that is something that matters. So at SI, if you're a doctor viewing this and you think time is important away from the office, and that's something that may be a converting factor, why don't you let us know? Click on the link below and give us a call. We'd love to sign you up for the course. Now, let's talk about the implant training itself. Implant training, great training throughout, okay? You can take the longer pathway, do your education, and you go into your training program. Just make sure you're choosing one that gives you those live patients, okay? The SI pathway, the training program, we teach you how to place implants, We teach you fresh placements. We teach you immediate placements. We teach you atraumatic extracting. We teach you every single way cut from Tuesday how to graft. We actually teach you stem cell grafting. If you haven't learned sedation dentistry, we actually get you exposed to sedation dentistry by actually sedating a lot of your patients. And actually, I don't believe there's another training program facility that's designed for sedation dentistry. Now, a lot of times people get into surgeries, they don't have a sedation experience. So we find that actually doing sedation in our program is a very useful tool that educates our docs. You know, each one of our students, we guarantee 10, but each one of our students right now, the average is 18 placements in 4 days. And our job, from new graduates to guys that are doing a couple in their office here and there, is before they leave, each one of these, at least in level 1 course, each one of our students is able to walk home. Their last day, they're doing a big case. Each one gets assigned a big case before they leave. And they gotta use all the skills that they learned, so the last day, they gotta do 8 extractions, 6 immediate placements, graft the whole thing, and then they're done. Pretty intense. So we also work on speed, so you can actually do the surgery in a time-effective manner. It doesn't take 5 hours to do 12 implants. And we're gonna show you how. So you can compare the other training on here, okay? You got some of the other countries, they got a lot going on, okay? You get a ton of experience too, but you gotta fly out of the country. So the training thing is really important, as well as there's some programs where I know one of my students was good program, we retrained her. She wasn't allowed to do immediate placements until she actually got to place 50. Our students get immediates and they get fresh, and we're actually teaching them guided as well. So guided is pretty easy. So when you start learning how to place implants, it gives you expansion, so when you want to go and take another course, it makes more sense. So our students getting out can place any kind of system that's in the market, and they're very well rounded. So if implant training is important to you, we will teach you all the necessary big procedures in the surgery to make a profound impact in your practice. So if that's important to you, look at the click on the link below and give us a call and we'll get you signed up. Another thing to think about is cost, guys, okay? I mean, cost is a huge factor. If you take these other pathways, the cost can range from $6,000 even up to $40,000 for the course itself. You know, that's a pretty big expense, you know. And so you guys are gonna have to kind of weigh the cost factor for yourself. But in the SI way, 4 days is $9,980. It's a pretty hot deal. So, you know, when you're comparing the cost factor, now when we back up to the time that we talked about in the first section here a few minutes ago, you're out of your office quite a bit. What about the hotel bills, the flights, the time away from your office? That's all cost additions. So from a cost perspective, the SI pathway, all of our classes are booked from Friday through Monday. And it's done for a purpose, because we want our students not taking too much time off of work, and it's very easy within your schedule to be able to knock off a Monday and a Friday to be able to come in here, fly in, and have some fun. We're also actually in near Scottsdale, so it's kind of a pretty fun thing. Now, backing up to the implant training itself, go to our website and take a look at our live interviews with our students. And what you'll notice is you're going to notice the training facility itself. It's absolutely drop dead gorgeous. We want to simulate a real live practice where you guys are practicing in your own practice. The training facility is very high end. It's beautiful. Our patients are real. They're going to be going back to their dentist, or they're actually going to be staying at the faculty office to continue treatment in their post-op care. So these are all cases that are set up in reality. They're not bums from the street, okay? They're not people that don't have continuing care. They're real life scenarios that you're going to have to take care of when you're here at the Institute. So cost-wise, if cost is an important factor, give us a ring, and we'd be happy to take care of you and get you signed up for the course. Last thing I want to talk about is credibility. You know, credibility is really one thing. It's in the proven results. Take a look at our website, and once again, take a look at our interviews from our doctors. We have trained doctors that have zero experience fresh out of school. We're actually doing lectures for different universities that want to tie our program into their program. We're retraining doctors that have a good foundation, but they're lacking the speed. So, one of my students, places 2 here, 3 there, but has never done a full arch surgery. And he's like, how do I do it? Well, now, after 4 days, he's going home and he's doing full arch cases. Our level 2 class is going to be full mouth cases. So that's coming. You guys want to kind of keep your eyes out for next year. But from a credibility point of view, it's in the results that we have. Our students go home and they implement. So the I in learning a new skill implementation is when they're here, they're under so much scrutiny and intensity that when they go back home and they got to do 2 implants and they're 2 immediates, they're not even sweating a brow because they just got their butt kicked 4 days before and they just did 6 implants on 1 patient under sedation. So that's how you learn. You put somebody in an uncomfortable position and you just tighten them down with guidance and support, of course, and you will watch that you actually do change. So credibility too, we're getting promotions from a lot of great education groups. Like one is Docs Education, one of the best sedation training courses that I've ever taken and had the pleasure of working with. So credibility wise, multiple universities are taking a look at us. They're loving the implementation process, and we're doing a lot of good for the dental industry. So if that's important to you too, take a look at the link below and give us a call. We'd be happy to sign you up for the next course. So in conclusion, I know I just went over a ton of stuff, but in general, our aim is to get you, if you are trained with implants, we're going to get you fast at what you do, faster and faster, with perfection, just like a specialist. It's an intense course. It's a private course with results. It's going to save you time away from the office. You're going to be able to get back and implement it immediately. And we teach you all the things that are necessary. I think that's pretty much all the things I wanted to make sure I covered. But I really appreciate you viewing this. It's important to us to be open. And when you're a student here, we will make sure that we're giving you that as we say, post-op care with your patients. Our students are part of our SI family, and we're here to back you 100%. So look forward to teaching you, and if you have any questions, feel free to give us the office a call, and we'll be happy to get you scheduled for the next course coming up. Thanks much.